For the record, the chair of this committee, Councilwoman Cindy Bass, has a show for her daughter, and she is a mommy, and that is extremely important. And so we are going to excuse her today. I am vice chair, and I think I can handle it. So shout out to mothers who go to Christmas plays, right? That's right. That's usually important. Having established, so the Committee on Public Health and Human Services, having established the quorum, to my right is Councilwoman Blondell Reynolds-Brown, and I also want to excuse her because she had a prior commitment. Many of you know we changed the dates 2 or 3 times, so my apologies, and we wanted to get it in before the end of the year and before the holidays, so we will excuse her at the appropriate time so she can complete her duties. To my left, Councilman Greenlee, Bill Greenlee, and to his left, Councilwoman Helen Gim. So for the record, I'm going to have the clerk read the title of the bill.
Resolution 180037, a resolution authorizing the Committee on Public Health and Human Services to hold hearings to assess the City of Philadelphia's efforts as coordinated by the Managing Director's Office and our Human Services Department to prevent and treat abuse, addiction, and disease related to the use of opioids.
Thank you. Just for purposes of bringing people up to date to where we've been. This resolution was introduced on January 25th, 2018. That's right, 11 months since we started this process. In April 4th at Visitation Center, we had a similar community meeting and discussion both with the administration and members of the community. On March 12th in City Hall, we had a public hearing to speak about the bigger portfolios and human service providers and the city departments and their response. And now we're here at McPherson Library. So there's been a series of meetings. All of the testimony related to those hearings are public record. You can get it on the City Council Legistar, or you can contact our office, and we're happy to share with you the transcripts. We have an official stenographer. This will be taped for purposes of public access TV, government public access TV. Do any of my colleagues have a comment before we begin? Okay. I want to acknowledge there are many people in the room. I thought I saw Representative Holstein here. Is he here, Joe? Joe, thank you so very much for coming, and congratulations. Look forward to another partner in this work. Want to recognize Donna Allmen, who is the ward leader of the 33rd Ward, which we are in her ward, and some of you who will be testifying, we will introduce as we begin. I'm going to ask the administration to come in first, and then we'll ask a couple of questions, and I do want to get to the community. We are going to ask community members to, especially for those who did not submit written testimony, to do the testimony within 3 and 5 minutes. I promise I am going to get everybody out of here in 90 minutes. And I'm going to stick to it. I'm a stickler for that stuff. We're going to get out of here in 90 minutes. So, what's that? 7 o'clock. 7 o'clock. We started 15 minutes late, so we'll allow that grace period, but you know how we can be, so I want to be clear. So first of all, many of you have participated in one way or another, either in the Kensington Civics Group or as part of the emergency declaration made by the mayor that folks will speak to. And when we have Tumar Alexander and Joanna Alberto Cruz, they can speak a little bit to that. But before that, we started a conversation around a systematic reform for treatment and services in our Department of Behavioral Health. So I'm going to ask David Jones, who is the director of our Department of Behavioral Health, to come forward, and Liz Hirsch to specifically address some of the reforms that the system has accepted, part of the recommendations in the initial hearing that we had in March, but really a lot of the input from hearing from the folks, both from the community and in addiction. So I'm going to have them first speak to the entry access to treatment and the bigger picture that we're doing. And then we will have Tumar Alexander, who I hope he didn't volunteer, because if he did, he's crazy, who has been leading our Project Resilience project, and he can speak specifically to the emergency declaration and some of the work that has been done in the community. So with that,
although the Chairwoman isn't here, as indicated, good evening, Chairwoman Cindy Bass, Chairwoman Maria Quiñones-Sánchez, and other council members on the Committee of Public Health and Human Services. I am David T. Jones, Commissioner of the Department of Behavioral Health and Intellectual Disability Services, DBHIDS. Thank you for the opportunity to testify in response to resolution number 180037. DBHIDS is responsible for oversight of a provider network that serves children, youth, adults, and families in Philadelphia with behavioral health challenges and or intellectual disabilities. Today's testimony will focus on the DBHIDS response to the opioid epidemic and reforms and barriers of accessing substance use disorder treatment. Much of this work is centered between the divisions of behavioral health and community behavioral health, CBH, which is a city-governed, nonprofit managed care entity that serves as a payer for behavioral health services for individuals eligible for public health or Medicaid. The Division of Behavioral Health serves as a payer for individuals without insurance. Our work touches many lives. Both national and Philadelphia data indicates that 1 in 5 people experience some form of mental illness or substance use disorder. In calendar year 2017, over 700,000 Philadelphians were eligible for Medicaid via community behavioral health. During that same year, over 120,000 people participated in treatment between DBH and CBH, representing approximately 21% consistent with national rates of behavioral health services utilization. I will underscore the point that ensuring that individuals who have opioid use disorder have access to treatment is among our highest priorities as a department. We're equally committed to helping community members feel supported in their neighborhood. We are working and we're making progress. In calendar year 2017, at CBH, more than 32,000 individuals utilized substance use disorder treatment services. More than 15,000 of whom were treated for opioid use disorder. This demonstrates an increase of 6,500 individuals who utilize substance use disorder services and 1,500 individuals who were treated for opioid use disorder in calendar year 2016. To give you a sense of the size of our network, CBH contracts with more than 175 separate clinical programs, service locations to treat persons with substance use disorder and mental illness. These contracted entities comprise over 2,000 beds, including inpatient hospital programs, residential programs for rehabilitation, detoxification, and halfway houses. In addition to the bed-based services, CBH also offers member services of varying levels of intensity within ambulatory and community-based settings. These services include outpatient, intensive outpatient, partial hospitalization, and services designed to keep recipients in community settings such as case management and payer management services. In our efforts to address the epidemic, certainly they centered around making sure that treatment is accessible and making sure the treatment is high quality and effective. In the area of opioid use disorder, the most effective treatment is medication-assisted treatment, MAT. MAT is the use of medications such as methadone, buprenorphine, or Suboxone and Vivitrol in combination with counseling and behavioral therapies. Research has demonstrated a 75% reduction in mortality in patients treated with buprenorphine versus people treated with psychosocial interventions alone. Therefore, much of our work is focused on increasing the availability and use of MAT in all Philadelphia in terms of each level of care. Despite the overwhelming evidence of the efficacy of MAT, currently 65% of our SUD providers offer a form of MAT, and we will continue to work diligently to have our whole network reach 100% in terms of being able to offer MAT. Given the efficacy, again, of MAT, we launched Next 24-hour, 7-day access point, which has been accepting members with a full range of SUD and withdrawal symptoms for assessment, stabilization, and referral to the appropriate level of care, also using warm handoffs. You'll hear a little bit more about that from Regan in just a bit. Temple Episcopal's Crisis Response Center has been enhanced with hiring dedicated staff to engage, assess, and treat individuals with opioid use disorder. Again, I think you may hear more from Dr. O'Gurk about that. MAT, we've expanded capacity by 3,000 slots during 2018. CBH issued 3 bulletins to its provider network to increase education, individual choice, and the availability of MAT. This includes short and long-term residential substance use disorder rehabilitation and halfway houses to provide MAT-compatible services. All SUD providers incorporate, again, medication-assisted treatment options into planning, treatment planning, and then making sure that there's informed consent as a part of that process, and that all providers to make MAT available by 2020. To further increase access, we've also worked with the provider network to decrease the time of induction, that is the time that people are actually placed on medication-assisted treatment, to expand night and weekend hours, and to coordinate linkages after an individual is discharged from one level of care to another. Regarding barriers, we've actually worked to remove managed care requirements, for example, drug screens, and vital signs. It's been kind of a sequential, historically it was a sequential step set of which getting the drug screen was the first part, and what we said is move into treatment and we can kind of get that as it goes. We've expanded the flexibility of ID utilization, particularly for opioid treatment programs, and then we've ended prior authorization requirements for short-term substance use disorder treatment. We realize that there's more work and change is still needed. We're committed to addressing the barriers that remain and to capitalize on opportunities to increase access to treatment across multiple settings. We've actually also offered several training opportunities to improve access and quality of SUD treatment. We've launched a monthly medication-assisted treatment learning collaborative. We've also, DBHIDS has held 26 two-day American Society of Addiction Medicine trainings, which essentially help clinicians completing assessment for substance use disorder, determine essentially medical necessity and level of care. We've worked with all of the recovery houses on training focused on MAT, and we continue to have those trainings open to all recovery house staff. And then there's also, we've provided buprenorphine waiver trainings to 183 Philadelphia prescribers. We've also, we're increasing access by bringing engagement resources to individuals. That includes CBH member services, along with 2 certified peer specialists, one of which is here tonight, that work at the Mural Arts storefront here in Kensington. The mobile engagement unit via our relationship with Prevention Point is offering MAT inductions here in Kensington. The mobile outreach program via Amerikey is engaging individuals on a daily basis, utilizing innovative approaches like Uber Health as an example. We also have convened a network of behavioral health providers in Kensington to facilitate warm handoffs and foster referral relationships, particularly between kind of the mental health and then historic substance use providers. And then we are certainly working very closely with Liz Hirsch, Office of Homeless Services, including deploying additional outreach teams to help individuals experiencing homelessness. Multiple additional resources have been provided, including the mobile engagement teams, and we have worked with again, our provider network that includes, in this case, PHMC, NET, Cadenzia, Amerikey, Wedge, Pathways to Housing, One Day at a Time, Pearson Journey of Hope, our project, our consumer satisfaction team, Clean Slate, and again, I had mentioned Prevention Point. There are over 70 in-network behavioral health program locations in Kensington. These programs provide a wide variety of services to children, adolescents, adults, and include federally qualified health centers, mental health outpatient programs, substance use outpatient programs, intensive outpatient programs, res rehab, halfway houses, and acute inpatient psychiatric programs, along with children's partial programs. We are excited about what that continuum includes. And what I'll do is actually, I'll stop there. We certainly have provided an overview of the department's response to the opioid epidemic and our treatment continuum. and will continue to focus on reforms in areas of accessing substance use disorder treatment. Appreciative of the opportunity to testify this evening, and if you have questions, I'm happy to answer them now.
Before we go to Liz, and unfortunately we only have one microphone, I hope you can hear me. Okay. You spoke to 70 locations in Kensington. As you know, some of the concerns with the community and long-term residents is Kensington is the locating of all of these centers. Is there, I know you launched a new website, where can people go to see who are the 70 locations and the quality and the contact person for those providers?
Yeah.
I know you have a table here.
Yes.
But for long-term residents, people should know there's 70 providers in Kensington, who they are, the level of quality, and the contact person for folks. Do we have that available?
So a couple responses. One, so folks should know that we actually have a 888-545-2600 number that operates 24 hours, 7 days a week. You can call that number. A live person will answer, and certainly to the extent that you are looking to participate in treatment, they will direct you to treatment. In addition to that, if you go on our website, you can see there is a map of the providers and where they are located, along with the type of levels of intensity of treatments that they provide. There's also we have on our website a fact sheet that lists kind of, again, all the providers, particularly by category. So there's these are all the substance use providers who in outpatient, intensive outpatient, those that are providing medication-assisted treatment, and so that information is available.
And the contact person or the person responsible for that site?
Is correct, that information is available.
Okay, thank you. The chair recognizes that Councilman Swola has joined us. Thank you. Chair recognizes Councilman Reed.
Yeah, can I just say something real quick, and I don't know if this is under exactly your auspices, because you were talking about treatment, and obviously all that is very important. How much have you looked into the sources of people getting addicted? I'm particularly talking about the overprescribing of medications, that kind of thing. Has that been something you've looked at, or?
Well, I mean, so there has been, we know coming out of the mayor's task force to combat the opioid epidemic, there were the 4 broad strategies: prevention, education, treatment, overdose prevention, and then criminal justice involvement. So there's been concerted effort, certainly working with the health department to get information out to prescribers, to share information about inappropriate opioid prescribing and to reduce the number of opioid prescribing. So there's been that information we're working with, again, the health department to get that information out to physicians across the board so that they have a sense as to what their prescribing patterns are. There's also been a host of information provided that says, look at alternative treatments to opioid, and so we've been, I think, pretty expansive in sharing that information and trying to address that issue from both prevention and early intervention perspective.
No, I appreciate that, and the health commissioner has been, very active in that. I have to say really quickly, Councilwoman Batts and I introduced a bill that just got passed out of committee that tries to put some regulations on the pharma industry, because that is, I think, a big concern about that leads to overprescribing. We tried to regulate gifts, register them to know where they are. This bill originally started with the administration. Councilwoman Bass and I have taken it up, and just for the record, everybody here, we're hoping to get this passed. It can come up on Thursday. We'll see what happens there, okay? But I think that is a key. Obviously, what you're doing is very important, but I think trying to stop it before it gets to that level, before that downward spiral starts, I think is extremely important, and that's what we're trying to do. Because we know this is a multi-pronged issue, and it takes solutions, if you will, and that's what we're trying to approach it from that angle too, with everything else you're doing. So just for the record. Okay. Thank you, Madam Chair.
Chair recognizes Councilwoman Gim and then Councilwoman Blondell Reynolds-Brown.
Thank you, Madam Chair. So I appreciate some of the services that DBH-IDS has been giving out. I think the impact in the community has been profound on young people in particular. Could you talk a little bit about some of the school-based work that you're doing at all in some of the schools? I think in collaboration with CBH, we were able to bring in a number of social workers into schools. So, helping me understand what are the kinds of school-based work that you're doing with the school district or other schools in the area to help young people in the community understand that there are many different, they need a lot of support trying to understand what's happening around them, and we want to make sure that they have it.
Yeah, thank you, Councilwoman Gimm. It's a great question. I think, as you point to, so we have worked in terms of both DBH IDS and CBH being a part, and working with the school system to bring up the support team for educational partnership. That was the STEP program that you just alluded to, where there are the 4 disciplines that include the social workers, case managers, behavioral consultant, and then essentially a family navigator. Bringing that program up in 22 schools, I think that is certainly part of a broader approach to take to get more prevention. Beyond that,
which ones are here in this community? Where does the STEP program apply in this community? Which schools would it apply to?
So I can give you a list of exactly where they are. I didn't bring that with me, but we can make sure that we get that information out so you know exactly where they are. And then beyond that, we have, through the department and CBH, been working with the school systems for a significant period of time. So we have prevention programs. So all total, through our prevention programs and our treatment, we actually are in 250 of the schools, and we provide, again, a range of prevention, treatment services. We actually, in addition, we also have been working with the school system around looking at how, for example, our behavioral health rehabilitation services, how that program has rolled out, and we are looking at also our school therapeutic services program, looking forward to say, does this program continue to meet the needs of the students in the school system, working with them about potentially, probably in a year or two, doing maybe a whole new procurement to say, to identify a model that most effectively serves those kids. So it really is a range in terms of services that we have provided to the school system. There's also some specific focus that we do on through some of our providers, working with youth who are at risk for substance use disorder, and doing, again, some family work, going in, doing that preventative work to inform families on, again, the signs and symptoms of someone who may be experiencing a substance use disorder, and to show that there's actually a different pathway forward. Again, we're in 250 schools, and that work has been ongoing.
Yeah, so just for clarity, I'm very appreciative of and recognize that DBH has a lot of programs. I think I'm looking for depth and not like breadth across the system. So there is a particular crisis that we're facing. There's particular schools and communities that we know are very vulnerable, and we know the geographic boundaries within which they happen. So I guess I'm curious about, so I know we talked about the STEP program, and I have the list somewhere. I was just trying to see if you knew, in this community, whether you could say where those specific schools are. But I want to make sure that we're being very targeted. There are a lot of services that the school district offers, but when young people are going through extremely difficult times, the community is suffering, young people suffer 10 times harder, and they can't even put into words what they're experiencing because it's all around them and it feels overwhelming. So that's why we wanted to put a nurse and counselor in every school. That's why we wanted to explore the STEP program, try and do something different other than what we've done in all the other programs. But I'm curious about, how deep can we go with schools and to get some concrete outcomes rather than just rattle off the programs that we already have. So, I'm pushing a little bit here, and I'm going to push the district on the same question too. They should have sharp answers, and I need to know names of schools, numbers of children served, I want to hear outcomes. I want to know that these young people are really responding to this, because we're putting our effort into this STEP program, so we want to make sure there's something coming out of it.
The only thing I wanted to add, I'm Joan Nuri. I'm Joan Nuri, I'm the CEO of Community Behavioral Health. And in concert with what David reported, for this particular community, We did do a number of things, and so I don't have, I can give you the data with the number of kids, but a couple of things really from the beginning. One is when we were advised in the very early days of some of the challenges the schools were having in even opening, we rallied our agencies and said, can you go out routinely on the street and actually look for and help with kind of looking for kids and families to make sure that you're intervening if there's something going on as they were going into the school. So we did that and implemented that, and then now the city has taken on even more safe streets and safe school activity. We also pulled together all of our prevention and STS providers and in the school districts in this immediate area, the schools in this immediate area, and asked them to make sure that they were, going to the principals, because the principals have reported to us that it's not only the children, it's the families, it's the principals, it's the teachers. Everyone is experiencing a level of trauma that has been of concern. So they've gone to ask, what can we do? What can we do to support you? What can we do in addition? We also have Cora, who is here tonight, who does prevention services and really connects with those agencies and those schools particularly where they're trying to do deeper dives with children. So some of the data we will have will be more general because we're not going to label those kids as having a Medicaid episode. We're going to talk about the trauma that they might have experienced in that building, and are we giving that building enough support? And then I would say finally, actually yesterday, we had, as David pointed out, the convening of the Kensington and Allegheny providers. Again, it's just to create those linkages between agencies, and we did a focus on schools. And we had our educational staff there along with some of the providers who are providing those services in the school to talk about, are there more best practices we need to do? How are we identifying these, et cetera? So, we really are, trying to intervene. I think we haven't gotten as much feedback from the schools, is it making a difference or not yet? And I think that's, work in progress.
I think it's really important that, again, we're here talking to Kensington residents because this is the epicenter, and the ability to give them a little bit more details about whether it's on our website or schools, and look at, is there a consistency in what we're doing at the schools, right? So if I'm a parent and I walk into a school, I should know who's the behavioral health provider there, who's the point of contact, if there is that kind of exchange. So I think that's what we're looking
Yes,
for.
and similarly, like there's a Safe Routes program. Those are operated through the city in collaboration with the school district. Like if the concern is about a route to school in which young people may witness things or feel not safe as they walk, we closed down a number of schools in this community as well. So, I want to make sure that we are in communication with our parents, our community members, and our young people, so that we should, I want to hear stuff like, yes, we've doubled the number of people monitoring the safe routes, and that the city has to step up to some extent on that. And then I want to hear the young people saying, hey, it feels a little bit different for us. Even despite everything that's happening to us, we feel like at least there's folks looking out for us when you're, 10 or whether you're 18. It really, this is, I know you feel this way. But I'm going to be looking and pushing for a little bit more specifics and specific schools, and letting the community know which schools have it, which schools are on, on a standby list for it, and that the councilwoman and others in the community can direct people towards that.
Chair recognizes Councilwoman Blondell Reynolds.
The other thing I would want to add to those, that just in terms of youth voice, we also have youth motivating others through the Voices of Experience. So we actually have a very active part of the department where, for example, Shahid Days, who is our youth leader in that's part of our System of Care grant, where there's a consistent effort working with families who have obviously experienced kind of psychiatric distress, that they are part of the, giving us information about how we can improve the system, how we can do work with the families, and in fact, how youth can play a role in leadership going forward. So I want to put that out there as another strategy that we're using in that. And I think, again, we can get back to you guys around some of the specific numbers of how many youth move members we have, and then some of the work that they are moving forward.
Thank you, Councilwoman.
Good evening.
Good evening.
One direct question, and then the two others to follow. You gave a projected date of 2020 to have the entire network do MAT.
Correct.
And so what might be the impediments that may prohibit or get in the way of your achieving that 2020 deadline?
Yeah, so there are probably a couple challenges. One is just in terms of getting all of the providers to complete the training. In terms of I had mentioned, for example, the buprenorphine waiver training, so that then we have, if you will, kind of positions at every site, within every provider, so we make that distance and go from 65% to 100%. And then candidly, there also are going to be some providers who say we want to take a medication-free pathway, and that they essentially is saying that, we really believe that recovery is possible without using medication-assisted treatment. So that'll be a challenge too. Now, we definitely believe that every pathway to recovery should be explored. It's just that the science is very clear about, particularly as it pertains to opioid use disorder, utilizing medication-assisted treatment is the best pathway to recovery.
Related question, so do you fund the providers?
Yes.
Okay, so if you fund the providers, I would think that training should not be optional. Training should be required by a certain deadline to achieve the goals that you're trying to achieve.
And you're absolutely right, Councilwoman, and in fact, that's what we've indicated is that, so it's actually mandated that providers participate in those trainings, but giving them the opportunity to make the adjustments and then set a deadline by 2020.
Okay. To punctuate Councilwoman Gibbs' point regarding the depth of it, I too believe in saturation. In fact, given the magnitude and the scale of this problem in Councilwoman Sanchez's district, there needs to be over-saturation. And schools become one contact point for young people. You've mentioned schools, you've mentioned prevention, STS, you've mentioned providers, you've mentioned CORA. We have senior citizen centers, we have libraries, any place where two people are gathered. I'm curious to know, where's the glue, where's the thread that ties all those worlds together in a coordinated way to attack this issue? Is government intended to be the glue? Who's the thread separate from Councilwoman Sanchez?
So what I will say is that we, through our Division of Planning and Innovation, we certainly participate in many community meetings. We attend kind of health forums. We share information about what's available through not only DBH-IDS, but our partner entities. There is concerted effort to make sure that, again, that the work that's coming out. So, for example, some of the work that we do is through our Evidence-Based Practice and Innovation Center, EPIC, is to share information around the most effective treatment strategies. And so part of what we've done too is we've made sure that, and this goes beyond the various entities that you mentioned, that they have information around, for example, trauma-informed treatment. So whether you are, I'll give you even a better example. We do work with grands as parents.
Okay.
And so in our work with grands as parents, obviously that's intergenerational work,
yes,
where we have shared with them, so about trauma-informed care, about trauma-informed treatment, about, again, good prevention strategies. And so as they are looking and certainly at developing their various relationships, we are an active partner with grands as parents in sharing information. And that's just an example. And I think that we do that kind of pretty much across the board.
Okay, my final comment and observation would be, any place where two young people are gathered, that CVS, that Rite Aid, that physician, that clergy member, that case manager, that social worker, what I'm not hearing is a glue and a thread that ties that all together where folks meet on a regular basis to examine where we are, what progress we've made since that last meeting, who's responsible for doing X, Y, Z over the next 30 days. And the template I have for that I believe could have some value. Under Mayor Street's administration, he had a blue ribbon panel that met for an entire year to look at how we look at systems for kids. We met monthly. There were subcommittees that reported to the chair. And all of those committees met monthly, and for a year, we examined how systems were doing and where recommendations needed to be made, and then in the second term, those recommendations were implemented. So a similar template, I believe, would have value here in bringing all the providers together, the SCS providers, the provincials, the heads of the schools, physicians, clergy, CBOs like Brands' parents, so that everybody has an articulated role in how we can address, further deepen our attack on the problem. Because it's happening, but I'm not hearing glue and thread that ties it together in the short time that I've been here and what I've heard Councilwoman Sanchez talk about often.
And the closest we would get is, so DBH IDS, we actually have an advisory board.
Okay.
That then consists of, and what I didn't mention is we also have, as part of that advisory board includes faith and spiritual affairs.
Okay.
And so it would be faith and spiritual affairs. In fact, we actually have labor represented on that advisory board. We have the providers represented on the advisory board. It's both child and adult providers. And so, and then we actually, that advisory board, it used to be, we had a number of different advisory boards. We brought those all together so that it would be much more integrated.
Coordinated.
Exactly, and information shared across.
And not just to meet and commiserate, but to meet with assigned tasks where folks are held accountable for those assigned tasks, with their reports given on what the progress has been related to the goals that are trying to be achieved. Because meeting is great, commiserating is great, but it means nothing if they're not achievable or articulated goals and outcomes at the end of those meetings.
So, yeah, I mean, I wanna stick to my 90 minutes, but I will say that we will have a further discussion, particularly around CBH reforms. And again, what I'm looking for, and particularly out of hearings like this, I want my long-term Kensington residents to walk away with some of this in their hands. I want them to know there's a website, we know who the doctors are, if there's a problem, who do we call, as it relates, again, to the 70 providers. When kids walk into a school, I mean, we had a successful morning this morning at Elkins showing some of the success around walking corridors. But again, we gotta get better at connecting the dots for folks, right? I want people to walk out of here with some concrete stuff, and we're getting better. So to try to honor the clock, I'm gonna quickly let Liz speak, give us a little bit of update on where we are around the housing issue, so that we can talk about Project Resilience, and then I want folks to listen to the community. So I want to get there.
2 points in closing real quick, Councilwoman. So one, just to point to, as you indicated at the beginning, so we actually have materials on the in the table in the back so that folks can walk out kind of with things, with material in hand. And then secondly, I think, as you will hear from Tumar and Joanne, I think the Philadelphia Resiliency Project, and this goes, Councilwoman, to your question too, where there were 35 departments that came together. I think you'll hear more about kind of the kind of comprehensive approach when they speak. So I just wanted to say that.
One thing, Councilwoman?
Yes, Councilman
One more thing before you end. We have a lot of good providers here, but we have seen in the past where we had some providers that left receiving a lot of money for fraud. Is there any way that we could make sure that's documented on the website too, that people realize what is going on so that we know who the bad providers are in the community and to try to avoid them in the future?
So, Councilman Squilla, a part of our process certainly is, I think that we have a pretty extensive oversight, kind of quality, compliance, inclusive of our network improvement and accountability collaborative. And so when those situations come to our attention, certainly what happens generally as an end result and an outcome, those individuals, those providers are moved out of our network. And so, but I think your question specifically is to indicate when those providers have moved out, and we'll certainly go.
when they are on probation, we need a report card. I want to know that of the 70 providers in Kensington, who is on probation, who has had issues, and who is, so people know that we're monitoring that, right? And if, for the sake of transparency, if people are getting government money, we need to know, right? This person's on probation for child services, or we removed this contract because of this issue, because you're talking to a community that has seen providers close down with thousands of patients. So I'm just saying, and I know we're working towards that, we're on a website, Be more transparent. I want the report card, right? And I want the community to have an input around what is quality, right?
And Councilwoman, we will send drafts to your office so we can get your info before we go. We take it to scale so that we make
I
sure.
want the
what we want.
community to see it, because ultimately, being a good provider is, I should not have to walk down the block and know you're there and you're being disruptive, right? I want the physical plant to be clean. Basic stuff, right? So, and I think we have not seen that in Kensington, and so that's why that list of 70 providers and people being able to see it, then we can get some of that feedback. And so that 215-888-2400 number is for people to access any of those providers.
Yeah, 888-545-2600.
Oh, 545.
545-2600.
2600, and that information is in the back table. Okay, that's the question right now. You can come later. That's the question. All right, we're gonna let Liz real quick, and then we'll go to the resilience project. Thank you, Liz.
Thank you very much for the opportunity to testify. I was asked to focus on the expansion of housing opportunities and specifically the role of the Temple Episcopal campus to host 2 new sites for services for people experiencing homelessness and opioid use disorder. So we're excited to see the augmented services as part of a medical campus, which we think is an appropriate site for these services to be offered. And we're very appreciative of the partnership of Temple Healthcare System. The first is the establishment of Beacon House as a low barrier navigation center for people exiting street homelessness. Located near the L stop at the Huntington L stop at B Street. It will hold 40 beds for men, women, and couples. Be open 24 hours a day. It will have on-site staff and security. We will ask that the provider establish a community advisory board to ensure transparency, responsiveness, and accountability to the neighborhood. So this is an innovation that we are adding in the new site. This site is slated to open early next summer. In addition, it'll provide daytime services such as laundry, showers, and bathrooms, which we've found to be successful in engaging people in accessing services. And we hope to continue to engage outdoor meal providers to host meals in indoor settings, as we have been doing in the Hub of Hope. We're working with Temple Health Systems to assure that individuals using Beacon House can access the comprehensive physical and behavioral health services offered by the hospital. So rather than recreating them on site, to use the resources that are already there. The second project is the proposed development of the School of Nursing building on Huntington Avenue into 62 units of affordable housing by Project Home. They have site control, which positions them to apply for the low-income housing tax credit to finance the development and operation. They have also secured the written support of the Norris Square Civic Alliance, the registered community organization. So not only will this development provide affordable housing opportunity, but it'll activate one of the many empty buildings in the neighborhood. But as you know, the tax credit takes about 3 years to go through if you're lucky. Therefore, Project Home has taken the extraordinary step of establishing a temporary site at Sacred Heart on West Hunting Park Avenue, a campus owned by the Dominican nuns where they used to care for terminally ill people who were poor. Project Home will operate 2 housing programs on this campus. A 20-bed respite for people exiting the street, which will open around Christmas time, and a 40-bed longer-term housing for those who are fully in recovery but need supportive housing. When the development of the School of Nursing opens in about 3 years, Sacred Heart residents will have the opportunity to move to the new site. The first 20 beds are scheduled to open around Christmas, and the second around Memorial Day. So those are our plans right now with Project Home, with a provider to be determined, and the Temple Episcopal campus. And some of the initial funds were part of the funding that City Council has just approved.
So real quickly, one of the, just so that as folks have heard that I have said no more of these sites in Kensington, is because we already have enough in the pipeline. This is a citywide problem, and we want to be equitable in the distribution of how these locations get sited. For the purposes of the 2 current respite centers, one which is coming to an end soon, what is the current plan for the 2 respite centers that we have on Kensington Avenue?
Currently, they are intended to sunset. We don't know exactly when. Part of it depends what other sites we can get online and what the street population is and getting people in. We need the beds for sure to be able to resolve the Emerald Street, the last major encampment. And then I think we'll want to turn our attention to K&A and resolving that encampment. So it certainly is our intention to look at the totality of services offered. The one thing that we did do at your suggestion, Councilwoman, was we did open one day at a time on West Lehigh Avenue, and it was a slow start, but it's at capacity. And what's really interesting is that when we've had focus groups with people in the prevention point respites, when they're able to get permanent housing or reunite with family or move on, they talk about getting out. And so ODAT has been a really good stepping stone for people. So we really have taken to heart a holistic approach to the extent we can with getting site control.
The deadline for Emerald Street?
We don't have a deadline at this point in time because we don't have the beds yet. We're working on it.
That's not what we heard at our last meeting. We were given a date of January 15th, which means a posting of December 15th.
We don't have beds right now.
That is a problem. Okay.
You're telling me. It's also a problem that it's going to be down into the teens tonight and there's people on the street and we don't want anybody to freeze to death.
Okay, so I'm going to, for purposes of time, I'm going to allow Cynthia Figueroa, the Commissioner of the Department of Behavioral Health and Human Services, to come forward because she has to leave. One of the things we continuously hear when we have these discussions is what is the city doing about our children and our after-school programming? And I want long-term residents of Kensington to hear directly from the administration our commitment to funding after-school opportunities, partnership opportunities for the young people of Kensington. So thank you, Commissioner.
So there are 3 step schools in the area. I just wanted to get back to that. I think it's Eldon, Sheridan, and Cramp. So I wanted to do
Elkins, Sheridan,
and Cramp.
And can you explain again for the public? The STEP school includes a social worker who serves the entire school, as well as what other services?
A case manager, a behavioral health consultant, and a family navigator. Those other 3 disciplines all will come on during the second half of the calendar year 19.
Buenas noches, hello. Thank you for having me here. I'm not going to read the whole testimony in the interest of time. I want to just address, and knowing that a number of you are former educators, doing our homework and knowing we're coming back home. For those of you who don't know, I served this district area for a good portion of my career, so it's great to be back home in North Philadelphia. As it relates to after-school programs, we are very pleased to report that there are 29 programs in this district, of which 20 of them operate in schools. And of that 20, 18 happen in school districts. This flyer, for the folks who are in this room, there's plenty of them here. It gives you the list of the location, the school, and whether or not it's sort of elementary, middle, or high school, so please take those. At the bottom of this paper, as well as the top, it tells you who to call, whether you want to do a website or a phone call to direct you to these sites, and then also directs you to general information. The other resource that I think is very important to share is that because we're Department of Human Services, folks assume that because of addiction, that we automatically would remove a child. And actually, unlike other counties, we don't. But we need to demonstrate that the child can be safe in the home, even if there is an addiction. That's a very complicated thing to work through. So on that note, we have also in the back our parenting resources. And there's a number of parenting resources that we have available. And in order to simplify it for all community members, there is one phone call, one number you can call that guides you, as well as a website, in terms of what are the parenting programs in your community, as well as parent cafes. So there's support groups, there's groups for parents who have kids actively engaged at DHS that are active in care, and then just if you're interested in having parenting classes. We talked a lot about the needs of older youth. We're also very supportive of intensive, another resource in the back, intensive prevention services for older youth who may find themselves wrapped up in the midst of the challenges of the opioid crisis. I do want to highlight an interesting dynamic that we've seen, and my fellow colleagues in Health and Human Services, is that the opioid epidemic has not seen an expansion in the number of families who come into child welfare. As a matter of fact, we've reduced the number of families who are with DHS by close to 500 individuals in over a year. So folks are surprised by that. Part of that is the demographic of what we're seeing in terms of who is being impacted, but we also know there's a lot of grandparents. So we also work with grants as parents. We know there's a lot of second and generation who are taking care of their children their grandchildren while their children are struggling with addiction. So we're trying to figure out all ways through our prevention services to make sure, but we drive these specific services and we have tried to simplify it in terms of access and availability to the community.
So someone seeking treatment and services who have a child, walk me through how we're handling that. 'Cause
So-
we want folks to be able
Sure.
to come and say, we need help. How are we handling that?
So thanks to the tremendous partnership that we have with behavioral health and CBH, we actually have staff that are embedded in our community umbrella organization. So if there's an active case and it's an in-home case, we would be working with that partnership to determine how's the best way to navigate getting them into treatment services if they're not already in treatment services. We also have to navigate whether or not somebody is not currently ready to enter into treatment services, and that's something that the case managers have to navigate. And so we, what folks don't always get to see behind the scenes is that our day-to-day work with community behavioral health and DBH IDS in terms of making that determination, because we're the child welfare social workers, we're not the clinicians, and so we lean on them as partners to figure out how to navigate that in the best way possible.
Thank you. Any questions for the commissioner? All right, we're gonna ask Liz to come back. Councilman Swola has a couple of questions for her. And then I'm gonna ask quickly, I know Reagan prepared to talk about her 24-hour NET program, but I do wanna give time for members of the community to take advantage of having all these folks here. So thank you for your patience.
I'm sorry, Councilman, just a quick question, and I know,
There are no quick questions.
Councilman Sands just touched on it, and we have thought that the January 15th date was going to be something that we've been telling our residents. And the problem we have sometimes when we tell people things and it don't come true, they think we lie to them. And so when we do throw some dates out there, we knew that the people who were going into the respites from Frankfurt Avenue would be there approximately 30 days to 45 days and then hopefully move on. Is that not happening?
We don't have time limits in our sites. What we have, well, the requirement is, I'm sorry for any misunderstanding. Well, the requirement is that they have a housing plan within the first 30 days that they are there. So it takes time. People are very, very sick when they come in, and it takes time for them to get on a normal schedule, to get their recover some physical health, hopefully to get into the medication-assisted treatment, to get ID, to just get fed on a regular basis, to get warm after being inside, to get clean. All of those things take time. And so even if we did have a time limit, I don't have any place for those people to move in 30 days, and it would be very disruptive. It would be counterproductive, really, to force them to move. What we were hoping was that we would have another site online. That hasn't happened yet. We're still working on it. Once we have another site online, then we'll be able to resolve the Emerald encampment. And, as you know, the law in Philadelphia prohibits the criminalization of homelessness, so people cannot be forcibly removed for being homeless. We have to provide beds for them to move into. And if we don't have sites that can open, then we don't have beds for them. And they have to be sites that they are willing to go to, because we can't, we just have no way of forcing them into services. So I'm apologize for any misunderstanding that there's been, but this is what the situation is.
Can you clarify, because you mentioned there were 20 additional slots created by a temporary site from Project Home, so what are those 20 beds gonna be used for?
Yeah, those 20 beds, when they come online at the end of this month, will be used for people coming in from Emerald and from other sites. Some of them will be coming from other parts of the city based on vulnerability. Yeah, so those 20 beds, there's 100 people in the Emerald encampment.
So, and I think it's really important for us to clarify for the purposes of the folks, we do have beds, but we don't have necessarily the beds that either people want to go to or that allows them to continue to use while we transition.
At this point in time, we have 0 beds.
Because it's winter.
We have 50 people who are sitting up every night at one of our men's shelters. We have 20 women sitting up in another shelter. Our winter beds are coming online, and we anticipate that they will also be filled.
So that was gonna be my next question. I know Eva wants to get on board. Every winter, we set up how many additional winter beds?
It'll be about 300 additional winter beds.
So why didn't we do that earlier if we had programmed the encampment?
The beds are coming on schedule. This is a matter of the budget and what we can afford to do. And so those beds are coming online. We've added 129. This is the winter beds. We've added 129 full-time beds. So those beds are all coming online.
Councilman, did you wanna?
The beds depend on the budget, and you don't have money for these beds?
Eva, say your name for the record.
Eva Gladstein, Deputy Managing Director for Health and Human Services. I see the councilman being frustrated.
Well, he's beyond frustrated, but he's usually very nice about it.
Agreed. It depends both upon budget, and we put money in the budget to begin bringing beds on in November and others coming on in December. It also depends upon the capacity of the organizations and their ability to get the beds up on a schedule and the location or the site availability. So there are several factors that go into it. What I wanted to reassure members of the committee is that it is still our intention to resolve the Emerald Street encampment in mid-January. But I want to be clear that to support Liz's point that we have to have enough sites that are available, and one of the concerns that I think everybody on the committee and in the community has experienced is that if we don't have sites that people will go to, then we have more people on the street. And we've seen more people on the street in less organized encampments or without tents but still sleeping. So as we are able to help people with their housing plans in the 2 sites move on, as the Project Home site at Sacred Heart opens up, which will only be 20 beds, and they're aiming for Christmas, but we don't know for sure because it's a development project. We are continuing to push very, very hard. But I want to say that's our intent, but whether or not it's January 15th or January 20th or something like that, we will be sure to keep you informed about that. So I don't want to be just,
I just want to be real clear that we've also been very clear because we are now very experienced on the nuances around posting, notification, and beds. The frustration you hear from Councilman Squilla and myself is that we have a code blue situation where every year we prepare hundreds of additional beds. And we feel that those beds should have been prioritized for Emerald Street because we made a public commitment to people that we were going to post in December, because I would think I was very clear about posting in December for January. To Liz's point, this is a crisis. It's 15 degrees outside. And I feel like people feel like they have more time, and I say this every time I have a hearing. We act like we have time. We don't have time. So how many additional beds, code blue beds, do we have? How many are coming online, and how many are going to be committed to Emerald Street? And I want that commitment now, and I want a date now that we're going to stick to, because we told residents one thing. And if we're going to have hundreds come online, there's no reason why they can't be dedicated to the people on Emerald Street. So.
I don't have the information to make a commitment today, and I don't want to make a commitment that will be a false commitment.
Liz, how many beds do we have coming on at Code Blue?
300 winter beds are coming on, and then there'll be an additional probably 50 to 75 flats.
So we have 300 cold blue beds, and you are telling me, Eva, that you can't commit today, that we're gonna commit the 60 to 80 that we know require for us to break down a camp? Is that what you're saying? You're not willing to commit, if we have 300 beds coming online, that we dedicate 80 of those so we can remove the Emerald Street encampment?
Well, we haven't done enough outreach to know how many beds we need, but we have well over 100 people at Emerald Street now. So if I use your assumption of 60 to 80, we can make those, we can offer those. It does not mean people will accept them, given the circumstances.
But we can do notice, and we could do everything we've done before, right?
And we can do that, and we may be less successful than we were before in actually clearing and holding the encampment.
The issue becomes, we know that Emerald is gonna be much more complicated than the other sites have been, right? And this is why we've allowed this kind of the last one. So I have a feeling that even where we were successful in the other encampment removals, Emerald is going to take a different dimension. So I'm gonna ask one more time, if we have 300 plus 50 beds coming online, why can't the administration commit today that they will prioritize 80 of those, because we recognize that Emerald Street is a crisis and that we are upon a deadline that we told people we were going to do?
We can commit those beds. What we cannot say is that the encampment resolution will be successful if those are the only beds that are available.
If we do the notification, as we've done in the past, right, we can begin, we know that this is not going to be as easy or as is going to operate in the same time span. So we need to be a little bit flexible in limbo. I'm not looking for the perfect, I'm looking for a pathway.
We can certainly look at that. The issue then is you may end up with people who are on other streets, they become dispersed around other places in the neighborhood.
We can begin the process, right? We set up a 30-day notice and everything, this is behavior. People modify their behavior accordingly. And in that process,
People will overdose if we spread the ball around.
excuse me, we're not gonna allow people to scream from the hall. This is an official ruling, everybody gets their moment. We know that it may take more than 30 days to clear out Emerald Street. So you're telling me that unless you could get it done in 30 days, you're not willing to do it. And I'm saying, let's begin the process. Because it's much easier to deal with Emerald Street at 50 people than right now that we're at 120 and exploding.
What we have done in the last 3 encampment resolutions that has been successful is that we had a model that we've been followed. And we haven't been driven by politics. We've been driven by what makes the most sense for the individuals and the neighborhoods. And this is the will that was expressed to us by the civic associations. And it's a combination of providing that 30-day notice, which gives a sense of urgency, because substance use disorder is a behavioral disability. And that sense of urgency and the deadline motivates behavior, combined with the low barrier respite that is in a place with a provider who they will accept, because we do not have the ability to force them in. And so we could certainly post and we could say you have to leave and there's a bed in West Philadelphia or North Philadelphia or somewhere else. If they don't accept that bed, then they may be living somewhere else on the streets in wherever they choose. So it's a matter of whether we want to follow a model that has been effective both for the neighborhood, because we have resolved
It
three
has not been
encampments,
effective for the
and
neighborhood,
because
Liz. It has been effective for the folks in addiction. The people in the neighborhood have been patient.
So we have 3 encampments that have been resolved. The civics asked us that the other encampments, that the other tunnels be posted so that encampments did not form there. We honored that request, and the police have been enforcing that, and that has been very effective. And so that has been the model that we've been following, and that's what we still are planning to do.
Councilman Scully, do you have any other questions?
No, thank
Because
you.
we need to move on.
That's the thing.
Councilwoman again.
So is there one we worked together a little bit on the anti-eviction task force. We talked a lot about what are the future things that could address some of the crises that we're seeing. One of the discussions has been about shallow rent subsidies. Obviously, is there, so with the new allocation of money from city council, is there a possibility to use shallow rent subsidies to assist certain people who might qualify for some of these beds, see if they can seek an alternative, thereby opening up more space, or offering shallow rent subsidies or some kind of voucher thing? Has that been discussed as a possibility of helping with this?
Yes, and we absolutely are doing
That's part of
that.
the budget, 5 million
that's what I thought.
allocation that we got was to allow for some of those shelters.
And will that, is that
It will
a
not take
method?
care of
It won't-
everything.
Right.
So it is happening. We have, this year, we've added 40 shallow rents, we've added rapid rehousing, we've added permanent supportive housing. We added housing first. I think about 50 people have already started to move into the housing first, into the shallow rent. So we are using that for people where it's appropriate to help them move out of recovery houses and out of the respites or transitional housing. And that's how we get the flow through the system so that we open up those low barrier beds. So yes, thank you very much for that funding. It is enabling people to move into those options. Yes, absolutely.
Thank you. So we're gonna move on to project resilience. Huh? I said 7, so Kumar and Joanna are gonna be quick so we can listen to residents. And I'm gonna call out some of the residents. We have Sterling Johnson and we have his written testimony. I don't know if the doctor's still here. Rosalinda Lopez, Ramon Cruz, Elijah Desamore, and Adrian Rivera Reyes. I apologize, folks. I'm gonna try to honor this time clock as much as possible. So be happy about that.
Good evening, my name is Timur Alexander from the Manager Director's
We're gonna ask
Office.
folks to, if they're leaving, to leave quietly, please.
Before we start to do our official Project Resiliency presentation, I just want to say one of the things that Liz didn't mention was that the funding that you all sort of voted for last week, the appropriations, one of the big budget items was a large-scale navigation center that we're currently looking at we're currently exploring locations and sites for. If we're able to stand that up, that gives us the ability to put about 100 to 150 folks off the street into a building, and it allows us to sort of speed up the closure of the encampment. So that's a big piece for us, right? And you all have worked with us, given us suggestions. We've been working hard trying to find locations for that. We have a location, not in the 7th district. We're hopefully next week talking to some community folks and a council member where that location is sort of situated at, and trying to stand that up. But we understand and relate to your frustration as it relates to that encampment. We want it closed. It's the worst encampment. Police wants it closed. Everyone who sort of is involved with Project Resiliency wants it closed. We'll get back to you all on that. I just wanted you all to know that we're working. That's a big piece that we're working on actively. So.
Thank you.
We'll be brief.
Okay.
Good evening, everyone. I'm Noelle Poison. I'm the Deputy Director for the Office of Emergency Management. The Mayor's executive order that declared an emergency to combat the opioid public health crisis tasked the Office of Emergency Management with coordinating our citywide response. Our Emergency Operations Center, or EOC, brings together decision makers and allows for face-to-face problem solving to ensure our response is smart and decisive. The EOC model cuts through red tape and allows for quick action and course correction. In the executive order, identified 7 overarching goals and assigned a city department as the lead for each goal. Those city departments are the lead of their mission area, but they do not work alone. The Philadelphia Resilience Project has brought together close to 40 city agencies and represented by almost 80 individuals to support all 7 mission areas. And the emergency declaration is for 90 days. The first 2 weeks, we convene daily meetings to support strategic planning for the 7 mission area leads. During that time, we finalized immediate, short-term, and long-term goals for each mission. Immediate goal deadline was November 15, 2018. Short-term goals will mark the end of the 90-day period in the initial executive order, which is December 31st, 2018. And long-term goals are defined as those expected to be completed within 3 to 9 months, June 30th, 2019. And the EOC has been providing weekly updates on our progress at www.phila.gov/opioids under blog posts. And Tumar will now walk us through the 7 mission areas with a focus on community support and impact.
Thank you, Noel. Mission Area 1 is eliminating encampments. In the interest of time, I'm not going to walk through all of the goals. I'll mention the mission areas. I'll let Joanna talk about her 2 mission areas as it relates to some of the community support, community engagement, and the cleaning projects that we've sort of encountered here. Then we'll be open for questions, both from members of council, and then ultimately we'll stay for questions from the audience. Mission Area 1, eliminating encampments. Mission Area 2, reducing criminal activity. Mission Area 3, reducing the unsheltered population. Mission Area 4, reducing trash and litter. Mission Area 5, reduction of overdose and harm prevention. Mission Area 6, increasing treatment options. Mission Area 7, mobilizing community resources. We've created and developed over 100 immediate short-term and long-term goals. Last month we reported out on the immediate goals on December 18th in this very building. We'll report out on our short-term goals. I'm sorry, my note says, just allow me to present some of the goals. Allow me to just highlight some of the goals. So, Mission Area 1, you guys heard a lot about the encampments piece. The last remaining encampment is Emerald Street, so we commit to coming up with a plan to eliminate that. Initially, we talked about January 15th. We want to stick as close as we can to that date. We'll go back between the next few days and work on getting a concise and clear message back out to the community as it relates to that. One of the other goals is developing comprehensive strategies to prevent encampments from relocating and reforming. That's a project that we're doing with the police department, with DBH, with homeless outreach, with our CLIP folks, and a lot of that revolves around us getting complaints and getting recommendations from the community, sort of letting us know where these camps are popping up at. We're trying to respond in a rapid fashion to these, and hope that we're being successful with that. Mission Area 2, reducing criminal activity. Just Councilwoman Sanchez talked a little bit today, and Councilwoman Gim talked a little bit about us sort of enhancing and strengthening our existing safe corridor routes to travel for school kids. Just today, we launched one at Elkins School. We have 3 or 4 other schools, Shepherd, Sheridan, and Willard on our list. And our intention and our plans is to work with the school district, work with parents, work with communities and volunteers to stand these programs up and make them sustainable. And then now I'll pass the mic over to Joanna to talk about some of her areas, and then we'll take questions.
So keeping it brief, good evening. Joanna de la Cruz, Deputy Managing Director of Community Services. The 2 missions that I'm going to talk about is Mission 4, reducing trash and litter, and Mission 7, mobilizing community response. These are the 2 that are really focused on the outward-facing responses to our residents' quality of life issues. So since the inception of the signing of the executive order, we have worked to coordinate 126 abandoned vehicles have been towed. That list continues. Is a very exhaustive list of over 400 vehicles in the neighborhood vacant. Over 32 miles of cleanups have been done by mechanical brooms. We've had 67 clean and seals. We know that that's not just a risk for fires, especially in the winter, but also conceals a lot of narcotics trade and other criminal activity. We've had 5,959 graffiti abatements in the neighborhood. 430 vacant lots have been abated, which means has been cleaned. Many of them, we're working with the local CDCs and civics to activate those lots and get them fenced with PHS. 19 tickets have been issued for illegal dumping. Short dumping continues to be an issue in the neighborhood. We've been working with the water department, in which they've done 877 cleaning up inlets, which is a common complaint in the neighborhood. And our Parks and Recreation is actually at the table as well. And they have removed over 4.55 tonnage of trash from their grounds. Mobilizing and moving to mission 7, mobilizing community residents, some of our response has been, we've had an incredible amount of volunteer residents just really coming out and wanting to really support their own neighborhoods. We've had over 435 volunteers for community cleanups, which includes 24 city departments also participating. We've had 4 major cleanups since the signing of the executive order. Created a specialized 311 response unit to intake community quality of life complaints. So if you call 311 and press 4, all of those, and anything that comes from this area, the East Division, goes to that pod. And we are utilizing that data and distributing among the 7 corresponding emission areas. To date, we have 1,190 calls that have been serviced by the unit, of which 824 requests have been confirmed to be resolved through the coordination at the Office of Emergency Management and all of the corresponding operational departments. We are seeking actively and working with the Councilwoman, Maria Quiñones-Sánchez, to locate a community resource center where we hope to distribute cleanup safety kits and co-locate Office of Emergency Management services, as well as co-locate a 311. And Councilman Squilla as well has been active in this conversation, where we hope to bring resources to community residents, those long-term community residents, including our newly launching program, Municipal ID, and working with local agencies in the neighborhood to see how we can support our residents. We've created a volunteer website, servephilly.org, where anyone who's interested in supporting or helping in some way, there's a short survey there. Individuals who want to distribute food or distribute any type of goods, or just be of service, can go in and sign up for it, and we are following up accordingly. We also attend and disseminate information of not just the Resilience Project, but we also try to share information through numerous PDAC meetings, community meetings. We have been hosting El Barrio Nuestro, the Neighborhood is Ours meeting for the last 2 years. And so we also have 311 present to follow up with individuals. We've also generated a bilingual, bi-weekly newsletter that is distributed to more than 5,000 individuals who have signed up for it. We have also created an advisory committee. The first meeting is going to be held on Monday the 17th, and we've just finalized the consultation of a fund development contractor, as we have to continue to fund many of these various things. And in closing, we continue to work for the quarterly meetings and trainings with recovery homes. We have many in this neighborhood, many of which are not necessarily sanctioned in our system, and so want to be an active partner. And we work not just with behavioral health services, but with L&I and with PARS, which stands for the Pennsylvania Alliance Recovery Residents. And so we are continuing to work with them and providing quarterly meetings and trainings.
So thank you. I want to reiterate for folks to listen. If you call 311 and you dial 4, all of those complaints get driven into Project Resilience and get priority in the 7 service areas. So long-term residents, 311, prompt number 4.
Yes.
You want to add something else?
Yeah, I failed to mention that in the audience, a lot of our mission area leads have joined us tonight. So if those folks are in the audience, they could just raise their hand. Thank you.
Any questions from our Councilman Squilla?
Yes, thank you, and I do want to say the Resilience Project was very cautiously optimistic when it was first announced, and I have to say there has been very successful start to the project, and I would thank you for that. There's been a lot of things happening within the communities, both for the people on the streets, as far as getting them help and resources that they need, and for the surrounding community who's been negatively impacted by what's going on in the streets, which is very important. And I know you heard me a little frustrated earlier, but the only part was that frustrating in that, when we do ask for a budget for what it would need to get things done, and we provide that budget, that it's still a resource issue, and that's the only thing that gets us under concern. We want to provide all the resources necessary to make this work, both for the people on the streets and the community. So we need to continue to work on that communication to make sure that we stay focused on that. And also, when we tell people something, we need to be able to stick to that, because it does make it difficult to go back. We have to build trust with the community, because a lot of them don't trust what we say because of things that happened in the past, whether it was helping the people who are on the streets, or whether it's helping the community surrounded by that. And so I will, and Maria will, I know all council will continue to work with you on that. It was a big ask for all of council for an additional budget push for this, and everybody supported unanimously, which very rarely happens. So that's a good sign. And so we want to continue that and continue this process moving forward, that we could definitely see positive impacts moving as long as we reached our short-term, our immediate goal. Our short-term goal was going to be done by the end of the year, and then our long-term goal by June 30th. Thank you.
Thank you, Councilman. I just want to mention that we want to thank you all. We want to thank the community, the civic leaders. A lot of folks in this room have been partners to us in this process. A lot of folks has given us advice, have sort of helped us out a great deal. So we appreciate that, and that's why I wanted to just clarify that the resources you all fought hard for last week to help us get that big budget item in there will hopefully go to us being able to eliminate and shut down that.
Can you quickly just go through, some of the money is going to street cleaning and some of the other things for the purposes of the folks here too, Mark?
I'm gonna let Noel go through those. I knew you would ask that, but I didn't bring the list with me. So I'm gonna let Noel try to go through some of that.
I'll spend it for you.
No, we won't have a problem spending it.
have a budget. Sorry, we're about to pull it up right now.
So we've also provided, it's in the back, Councilman Squilla and I pulled together some of the other investments. I know that we have, particularly for long-term residents, it feels like the air has all been sucked out around the opioid, but that does not mean that the councilman and I don't continue to work on other structural investments, and I want to list some of them while we get the rest of this budget. There is a multi-million-dollar infrastructure investment along Kensington Avenue. We will be putting fiber optics, LED lighting, and cameras from the Frankfurt Transportation Center all the way to Spring Garden. That is nothing new. It is not for the new people. We've been working on this for 4 years. There's nobody more frustrated than us
It's
about
gonna start
this.
within the lighting phase is the first phase, the camera phase is phase 2. Phase 1 is starting in the next 2 weeks, starting at K&A. Just got that commitment from the Deputy Streets Commissioner. So, and then phase 2, we're planning, working with SEPTA to sort of plan the cameras and where they should go.
The cameras and
how to
all,
set them
so
up.
so that project will be completed as part of this. As you can see, we have a massive cleanup trash plan that we've been working on again for years, and we're working with Impact Services, who runs the Kensington Carter. You'll see many of the trash cans that are out there. We have a whole identity campaign that is being funded by our Department of Commerce. Many of the rec centers in and around the Kensington Corridor have been projected and have seen investments. And I just want to list them again because folks say, you know, some of this isn't happening. We invested $400,000 at Hizzy Playground, $1 million at Collazo Playground, $1.4 at Waterloo, $50,000 at Hope Park for lighting. $700,000 in lighting here at McPherson. McPherson Library is also one of the first rebuild projects. That's going to be multi-million-dollar project that we're working. We opened up a PAL Center in the 25th Police District. Haggard Playground, Heisman Playground, Harrogate Park are all receiving direct funding from Councilman Squilla. Rivera in Fairhill is getting, we're under construction, and that's multi-million. There will be a beginning planning grant from McVeigh Playground. I mentioned the Kensington and Allegheny. We have a housing preservation pilot. We're working with Esperanza Health on the $20 million investment at Kensington Allegheny. And we've been working with SEPTA. They've been part of the partners here to add additional cleaning around their transportation centers. All of this was happening all of this stuff. You know, I know we feel like we get sucked up into all of this stuff, but both Councilman Squilla and I understand and appreciate the value of Kensington and the transportation centers and what it could mean for the neighborhoods. We are very pleased that the administration understands that these were urgent for us when we put them up. they're even more urgent now because we want long-term residents in Kensington to feel that they're just as important and we understand it. Going back to, and I'll let Tumar quickly talk, this morning we launched one of the Safe Corridor initiatives at Elkins. But Conwell School is one of the schools that has been impacted. We have asked the school district, and there is an entire busing program for the students at Conwell, Conwell is a citywide special admit school, and we have had many incidents there. So the school district is on board and also making investments so that we can keep the children safe to school and so that we can continue the after-school programming that Commissioner Figueroa spoke to. And now, Tumar, what are some of the additional? So trash is a major issue. We're asking those of you who are in the crowd, who are doing feeding and all of that, we really, really are pleading with you to register with the city and so that we can better coordinate this. When folks come from the suburbs, wherever they come, and they think they're helping us, if we don't pick up that trash, afterwards, people have to live with it. And so we are willing, the city is willing, Project Resilience is willing to help you set up trash bags, all the coordination, so that when you come and you leave, you remember that there are residents who live there who are going to stay behind with all of that. And so we're really, really begging and pleading for people's cooperation. Tumar, you want to end up?
I was just gonna say something, Councilwoman. For those individuals who wanna do a community block cleanup or anything like that, can contact CLIP through 311, and we can coordinate that. We can provide the brooms, the rakes, the bags, and then we coordinate with you for the pickup after it's done.
Thank you. Some of the increased funding is going to Safe Corridor cleanup campaign led by CLIP, fencing of vacant lots, some money going to equipment for the Safe Corridors to School campaign. There's a significant amount of money going to the newly formed Police Assisted Diversion Program that we plan to come back out to the community and talk specifically more about. Right now, it's operating in the East Division, in parts of the East Division. We want to expand that to the entire East Division and also make it 24 hours a day. Some more money is going to the Salvation Army to help them with their New Day program, which is a program that helps us identify and get supports for victims of human trafficking. There's a significant amount of money going to the Mirror Arts program to do a Kensington and Lehigh tunnel makeover. The Department of Parks and Rec is hiring additional seasonal maintenance employees for more increased syringe cleaning in and around in parks. The Health Department, I think some of you all may have seen in the community some of the big red mailboxes, which is our new needle boxes. We plan to put more of those out. Actually, they do. Actually, we've been, they do, don't they? They do. I'm telling you they do. She might beat me up. And we're putting, I've talked about, we're putting money into a navigation, the stand-up a navigation center. We're trying to put more money to increase community outreach workers on the street. I think we have about 4 to 6 new teams coming as it relates to that. A lot of these efforts are just, all of the efforts we're doing at this problem to try to put more bodies, more people on the ground, sort of being able to service and being able to alleviate some of the issues that we've been hearing in the community groups and through the residents. And also just thank City Council once again for helping us sort of get that unanticipated funding so we can do some of these items.
Thank you. I'm going to quickly have Reagan from NET, which is our 24-hour drop-in center, speak to that. And then I'm going to use the prerogative as the chair to allow some of our community residents. I'm not going to be able to honor anybody who just registered today. We're going to go through the people who pre-registered for this evening. Reagan?
Thank you very much. I am literally going to condense my comments to, I'm sorry, Regan Kelly, CEO and President of Northeast Treatment Centers, or the NET, as people often refer to us. I am only going to make 2 points. I'm going to condense everything so that the residents can really have more time. One is that I just want to say that NET has always embraced the importance of working with the people we serve and looking at things through sort of like the shoes that they walk in. So we have historically hired people who have gone through our treatment program and who are living in recovery. And you have to excuse me, I have a sore throat. And we have found that it is invaluable that they are the people who need to be involved in the outreach to really try to motivate and engage, particularly the people in encampments, to come in and seek treatment. So we have sent our peer team, peer specialists, again, people who have gone through our program, who have reached a life of living successfully in recovery, to talk to the people who now need to make a choice to come in and choose recovery. And the lesson learned from all of that, quite frankly, is that recovery is absolutely possible. And nobody conveys that message better than somebody who's living in recovery. So as you're all thinking about outreach teams and engagement and trying to convince people to come in and seek treatment, that's a really invaluable group of people to tap into. The second thing I want to say is that NET opened their 24-hour, 7-day-a-week access program in about May or June. Actually, I think we opened in April, but we have full licensing to do all of the medication-assisted treatment by June. And I bought bracelets because I would encourage people, as they're doing the outreach, to really leave the bracelets with people. We designed it specifically so that it has a phone number, and so that as you're talking to people, if they're not ready at that moment, perhaps someday, the next day, 2-3 days down the line, they'll become ready, because the trick of the Access Center is that people need to get treatment the moment they're ready. And that has been the biggest challenge, I think, of the treatment system, and all of the changes that Commissioner Jones referenced are really moving in that direction. So this is a critical kind of resource to be available 24 hours a day, 7 days a week. No appointment is necessary. We are fully staffed with behavioral health assistants, nurses, and peer specialists, again, to really have peers engage people in recovery, engage people who are seeking recovery. And they'll get a full assessment. We've seen about 1,600 people have walked through the door since we opened. About just under 1,200 have been fully assessed and referred to various levels of care, various treatment programs. The remaining people have been referred out sort of earlier in the process, because if they have an obvious psychiatric need or even an obvious physical health care need, we won't complete the process. What we'll do is get them, for physical health care, quite often it's an emergency, and we'll get them to an emergency room so that they can have that need addressed first. But then we'll work with that person and the emergency room staff to bring them back when they're ready to access treatment. I think the biggest part about it that is critical to the current crisis is that people can get access to medication-assisted treatment the same day. So the doctor has to come in and do the final stage of the assessment, and they can prescribe buprenorphine on site. We can administer it on site, and people can begin that induction process the same day that they come in. And again, it's kind of consistent with the notion that people need access the moment that they're ready. Pardon me? So those are the only 2 points I really wanted to emphasize in the interest of streamlining. I will leave the bracelets in the back. Please, bring them to the encampments.
So
put them on
Reagan,
the streets.
I've contacted you when people say that they come to NET and they haven't had access. Is there a phone number we can call? Sometimes people, as we're doing intervention in the street, is this the number people
There is a
call?
phone number on here to
So
get.
if someone tries to interface at NET, faces some dilemma, that's the number that they call. And I think this is really important, because I know that the system is working really hard at being open and being accessible, and sometimes I get calls, other people get calls. Somebody went to NET, they couldn't get service. Please call and get the information, right?
And personally, because we just recently shared a story that I was disappointed and surprised to hear, I'm gonna go and give my phone number out, 215-408-4943, that's my direct access line. If there is a problem, I would never sit here and say that 100% of the staff we hire are flawless, but what I do know is that the vast majority of them are deeply committed, work very hard, and that if there's a problem, we will fix it. The other thing we've done is that our other sites, we've added doctor hours 5 days a week at this point. We're working on weekends. We're working to address also weekends, so that we've adopted this open access model even at our other medication-assisted treatment sites. So people could get same-day access to what we call dosing at our other sites, one of which is up in the Holmesburg section and one of which is at Bridge and Harbison. So all of those addresses are on our website. And of course, our Fifth and Spring Garden site is where this is located, as well as a more traditional medication-assisted clinic. You don't have to come in through a crisis. You can also come in through, a planned method or walk in through the open access model at our Fifth and location site.
Any questions? Thank you so very
Thank
much.
you.
She is here and available if anybody wants to have any questions around NET, around NET. Thank you so very much. I'm gonna ask quickly, because I forgot I had Cheryl also, Dr. Pope from 8 p.m. Quickly, if you, again, and I apologize, I do want to get to the residents, providers, you guys have forums, my residents. Thank you for your patience and your cooperation. As soon as Cheryl, I'm gonna take my prerogative and allow you.
Thank you, Councilwoman. Good evening, Councilwoman Quiñones, Councilwoman, you guys have left already, Councilman Marcus Willa, and others, members of the council. Thank you so much Thank you so much for letting me provide this testimony to you today in response to the impact of the opioid epidemic in the city of Philadelphia. I am going to keep my comments short because it's important that residents get to speak. My name is Dr. Cheryl Pope, and I am the Vice President of Health Services at APM. I am on behalf of APM, President and CEO Nolda Ruiz, who couldn't be here due to a prior engagement. APM has been in the Eastern North Philadelphia community for over 45 years. We offer childcare services, pre-K Head Start. We have 4 mental health outpatient clinics. We have 2 drug and alcohol outpatient clinics. We have supported housing services, resource home certification with over 350 foster care homes, adoption services. We have designed and constructed over 300 affordable homes and a financial opportunity center. We also facilitated a Hurricane Maria resource program, helping individuals to access housing and other social services here in Philadelphia. We are a multicultural, multilingual agency that serves individuals throughout the greater Philadelphia area. A complete listing of our services appears at the end of this testimony, and you can also find out more about our agency at www.apmphila.org. In this testimony, I want to provide responses to what we have seen, what we have done with the city, how we see our efforts working, and our recommendations for the city. Again, I'm going to keep it really short. The opioid epidemic is really multifolded. What we see in our clinics are persons who present with addictions to benzos as well as addiction to opioid. We also see individuals presenting with who have been overprescribed opioids in response to pain versus providing physical therapy by doctors. Much of which is resulting in the overprescribing of Indocet and other opioid and Oxycontin medications. We are also seeing anxiety and major depressive disorder as the most common diagnosis and commonly prescribed benzodiazepines. Members come in and they have canned messages around their symptomology so that they can receive these certain types of prescriptions. We were working directly with CDH and ONSAS to address a need that resulted from a particular clinic being closed, a particular agency closing. There were 4 clinics and there were over 5,000 patients being seen. We presented to CDH our proposal packet along with others, and we were awarded the opportunity to maintain mental health homes for these individuals. For us, it was important that they maintain their mental health homes. If not, these individuals, as I said, 5,000 would have been lost to care. We don't want to see that happen. So over the past 90 days, starting from April, we stood up 4 clinics. And there were, as I said, 5,000 plus members who needed treatment. And over the first 90 days, we were able to ensure that no one got lost to care, no one lost their medication or any of that. And over the last 4 months, we have been reassessing individuals to determine if they really needed care, if our level of care was most appropriate. We provide IOP, OP, and Suboxone services to members as well. But this population, in the field, it has been said that meet members where they are, meet patients where they are, meet people where they are. Right now, these people are in the streets. We are restricted to providing services within the walls of our clinics. Our contract requires that we provide services in the clinic, but how do you get people into the clinic if we can't get out into the community? So, our agency has been around in this community for a very long period of time. And we need to be out there in the streets with our members, with our community services. And our current contract doesn't allow us to do that. All of the efforts of the city and the other agencies involved in this effort are great. They're wonderful opportunities. But as a CUA, as with CUAs, we right-size Child Protective Services to be in the community. What about right-sizing the small agencies such as APM to be available to go out and bring members in for treatment? To say that we make our numbers available, to say that we have our services available, there is something called a moment of sanity. In that moment of sanity, you have to be there. You have to be there to help persons to make that transition. A story recently happened. We also manage supportive housing services for individuals who are of low income. And one of the property managers called me because there was a person outside in the backyard of a resident using. The property manager went out to ask the person if they could help them in some way. The person said they wanted treatment. He called me to see what to do. I felt really in despair, helpless myself, because I couldn't go get them. I don't have the structure, the fiscal structure to send my therapist out to get that person. So giving them the phone number and the address and all that great stuff was wonderful, but by the time the property manager got back to that person, they were gone. So that moment of sanity is completely lost.
Thank you, Shirley. Thank you.
Thank you.
So I'm gonna take executive privilege. I'm gonna let Donna Allman, who's the board leader here, speak. And then we have written testimony for Sterling Johnson and Dr. David Gurick. So I'd like to get, I don't know if they're still here, Rosalinda, Elijah, Ramon, we have your written testimony, and Adrian Rivera. So go ahead, Donna.
Thank you.
Rosalinda, Rosie, that's all.
I don't think I need the mic because I have quite a loud voice. Oh, I need the mic?
Yes.
Sorry, people. I am the ward leader here, and my interest is the people in this community. And I'm glad that you are doing everything that you can for the people that have an opioid addiction. But I think you have failed the community. The reason I feel you failed the community, because you haven't done for our children enough. Our kids cannot go out and play. For Halloween, we had to block the street off and keep the opioid people off the street so we could let our kids trick or treat. The Pow Center had to do a trunk or treat because it was so dangerous. It is not fair to the people in this room who live here and do the right thing, raising their children, and have to watch the opioid people laying all over the sidewalks, using needles, defecating on our sidewalks, having sex on our sidewalks. This playground, Maria, you know how hard we fought to get the flyers in here to make the playground. The parents are afraid to let the children come to the playground. They're not, the only ones using playgrounds right now are the parents that drive their kids to Scaling for the ice game, or take their kids to the POW where it's safe with police officers. So when you worry only about the opioid people who made the choice, whether it was a good choice or a bad choice, they made the choice to use opioids. You do a disservice to every voting person in this room, every taxpayer. I am glad that you were trying to get them off the street. You're worried about moving the encampment. When you move the encampment, the hardest hit area was K&A. And the ones that don't go in are going to come to K&A. And they're still laying at K&A. They try to charge people to get on the L at 4 o'clock in the morning to go to work. They're laying all over. They're sleeping all over. They're defecating all over. When are you going to help our children? Yes, you were going into the school. But as my great-grandson is here, he doesn't go to school here. He goes to a charter school. We drive him. He has to drive past people putting needles in their neck in other places. He has to drive past people sleeping on the sidewalk. He keeps asking his grandmother and I as we take him to school, why are those people doing that? Why don't they do the right thing? I understand most of them have behavior problems, but they are so far past behavior problems now, they are nothing but addicts. There are some that you're going to save, But the ones that you don't save, do you intend to leave them here with us? You tell me you can't move them. When I was a kid, corner lounging you could get moved for. Obstruction of the highway. Kids walk in the street. Some kid's going to get hurt. Some kid's going to get hit by a car. And then the city's going to be sued. So, council, I commend you for the money you're sending them. The people, I commend you. But you're going to have to figure out a way to make those people move. Because they just can't stay here. It's not fair to us. We've been the hardest hit. Councilwoman's been fighting and fighting. You got the 2 respite center, you take them in at 8 o'clock and put them back out at 8 in the morning. All they do is sleep all over and take more drugs. You're not going to help them if you leave them out to take drugs. I don't mean to beat you up, but we're getting beat up. I cannot let that child go out and play. That's why he's sitting here with me. It's not safe. And the only reason he's going out there is because his great-grandfather standing at the top of the steps. But you just got to figure out, and you've had over a year, so why you don't have enough beds to put him in? Shame on you. Shame on you. Because this has been going on for over a year. So if you think these council people are frustrated, you should feel how these people feel who are afraid their kids are going to get syphilis, or going to get AIDS, or get hepatitis. That's why they don't want their kids playing out there, because they don't use the needles. My girl picked up 60 needles here the other day. I'm a diabetic. I control my needles. But you've got to figure out something before one of these kids really, really get hurt. And that's who I'm responsible for. Maria, you know that. My job is to take care of the people in the community and get them to come out and vote. You think they want to come out and vote and this is what they've got to live with? There's a lady that feeds them every Saturday and Sunday in the trash. G Street is a crying shame. I thought it was getting clean Saturday, but it didn't. But there's trash from Kensington Avenue all the way up to Sheridan School. You've got people sleeping in the schoolyards. Ride around and see what's really going on. When you go out there, they're sleeping all over Diamond Dolls and all over. My Hoagies Plus has to chase 4 of them off the step to open her store in the morning. We need help. You're helping the opioid people. I understand that. But you really aren't helping us, and you aren't helping the police. Because what are they going to do with them?
Thank you, Donna.
Thank you, Maria.
Rosalinda, I don't know if you want to let Elijah.
Yeah, you can.
Thank you for
Say your name for the record.
my name is Elijah Desmore, and thank you for allowing me to come up here and talk. I came here to talk.
Louder, please.
I came here to talk on behalf of the children who go through random stuff and are exposed to what happens outside there.
They were all exposed.
Me and my brother were making a movie just to show about how our new generation, like me and children, are being treated with being exposed to the drugs, the people just sleeping there, and when we were filming, we were walking through the encampments, and even when my dad was right next to me, I still felt scared. My legs were shaking, and I still had to walk through that. And I was just amazed because I still saw kids coming out of school, and they had to walk through there, and their faces were just frightened and scared. I could see it, and I did not like it one bit. And I just really I felt like it was the wrong thing. But not just that, I know it happens in more places. So I go to Visitation BVM Catholic School, and right across the street there's a tunnel. And when I'm coming to school in the car, I see kids walking. And when they're walking, they're looking across the street. And then there's a water ice store, and thinking about the kids who want to go out and get water ice, but then there's those people across the street doing drugs and doing it shocks me a lot. And I don't think that's right. While some of us are here getting rides to school, the others are walking alone, 7 years old, with holding their little sisters, no parents by their side, not having a mom or a father or anybody to look after them while they're walking by themselves to school, possibly gonna get hurt, step on a needle or anything like that, and yet nobody will care for them or aid for them, and I just feel like that is terrible. So I just felt like it was right to come here and talk about it. So basically, what I want is that, what I'm saying is that I feel like the children should be safer, and that the adults who do this should realize that the responsibility that they were given and how they should handle it. Yeah.
Thank you, Elijah. Is your movie available online? You're edited or you finished?
We need to finish this still, yeah.
So we will be sharing, we have some of the raw footage of Elijah and his brother filming the encampment story, and we'll make it available to folks as it progresses. Rosalinda?
Hi, thank you for allowing me to testify tonight. My name is Rosalind Lopez, and I've lived here for 30 years already. And we've always had a problem with addicts in this neighborhood. And only with the cleaning of Gurney Street has it gotten worse. With all these addicts around the corner, and I will call them addicts because that's what they are. They make a choice to live out in the street. And one of the pet peeves that I have with this resilience is the people who come out to Potter and Allegheny or Kensington and Allegheny to feed them, they give them trash bags so that the addicts can clean up after themselves. There are 5 trash bins on each corner of Kensington and Allegheny. They don't get used, so if they don't use the trash bins, they're not going to use the trash bags. They use the trash bags for whatever they want to use it. They might put a few trash, but the rest of it ends up in the corner of Potter and Allegheny or in Shelbourne, that little street across the street. I believe, my thing is that I think these people should be fined for feeding these people out in the street. Because I know that people get fined in Center City when they feed the homeless. So if they get fined in Center City, they should be fined everywhere else for feeding these homeless people, these addicts that make a lot of trash. In the last week or so, it has been cleaned to some extent. I've seen clip up and down Allegheny, but how long is that gonna last before the trash comes again? That's what I have to say.
Thank you for Rosalind. So I don't know if Adrian Rivera Reyes is still here. I know Ramon is here. Oh, Sterling's here. Okay, Sterling. And as I mentioned Sterling, because we're gonna wrap up in a couple of minutes. I do have your written testimony that will be added to the record. Is the doctor still here? Yeah, I can't, Asteria, I know you registered after we had, the list. So I'm gonna let you, come in, but I can't take anybody that was here, sorry. Anybody else who registered here today? And I apologize, to everyone, this is a continuing conversation, this will not be the last, hearing. Yeah. So, you guys are the last. Sterling.
My name is Sterling Johnson. I'm from Active Philadelphia. We're part of a coalition of organizations dedicated to expanding harm reduction and stopping the war on drugs. Thank you for providing this space. I will just say my main points here. I understand everyone wants to go home. Basically, we need to recognize that these are our people. These are people that come from all the parts in our city. They are not outsiders. They are our sons, our brothers, our daughters. We need to take care of them. These are our people. I think that there's an idea that these are outsiders, but these are actually the people that are in our homes. First of all, we need to have more housing, period. We need more shallow and deep rent subsidies. We need congregate living situations. There needs to be flexible funding with all this housing. Basically, this is a housing problem. These are people who are on the street. They do not want to be on the street. by providing more emergency respites, whether in Kensington, whether in different sections up in the Northeast, down in the South, in Councilman Scola's district, people will go in and then there will be a recess and they will be able to be discharged to housing. Right now, people aren't being discharged to housing. What are we even doing then? They need to be discharged to housing. Secondly, we need to stop the demand for drugs. Our advocacy is supporting overdose prevention sites. We have the same concerns for public injection. We have the same concerns to decrease syringe and trash debris. But we need to stop the cycle. People are not getting out of the cycle. More and more people are being on the street. More and more people are suffering addiction. The cycle is not ending. And it's not just the CBH or the Office of Homeless Services. It's larger institutions. People are discharged from hospitals. People are evicted from recovery houses. People are taken from prison and put on the street. There's no responsibility made for any of the people. And of course, we support Councilman Greenlee and Councilwoman Bass's legislation because all these institutions put profits over the people. They follow the money. Always, if it doesn't meet the bottom line, it is not their issue. And that's the problem with every single institution. Of course, we consider with development that'll come with this, that's going to come. I mean, we support the fact that, creating space for the people that are in this neighborhood. We believe that more city services should be dedicated to Kensington neighborhood. It is historically a Puerto Rican neighborhood for people of Puerto Rican descent. I mean, we notice that. That is important. We know that cannot be ignored. The whole point is that more city services need to be devoted to this neighborhood, and not just on a temporary basis, as the woman that was just up here said. This is a 30-year problem. That means we need to have committed resources that understand this is a 30-year problem. And when we're talking about what is going on over the city, we're talking that doesn't matter. It matters what is happening in Kensington, and part of that is the idea of places like Pathways to Housing, places, the Office of Homeless Services, and the rental subsidies. What I know as a person that is in housing is that poverty is concentrated in only a few neighborhoods. The private landlords do not accept the subsidies. Therefore, this is the neighborhood where there is going to continue to be violence, continue to be poverty, because I can't get a subsidy accepted in Mount Airy. That is what happens. And without taking responsibility for that and holding these people accountable for the discrimination that happens, this neighborhood will continue and honestly, that is what we care about. That is what we care about. We care about ending the cycle and creating this a space for across the whole city. People should not just be discharged to a housing property that's in Frankfurt, right by where they used to be. It's not going to work. We all know that's not going to work. All right. That's all I have. Thank you.
Thank you, Sterling. Thank you for your patience.
Good evening, members of City Council. My name is Ramon Cruz, and I'm a lifelong community member of the Kensington Fair Hill section. I want to start by telling you that I had a good childhood. My mother and father gave me all the love and support a child can ever ask for. They worked very hard to provide me with a great education. I went to St. Peter's Apostle from kindergarten to 8th grade, then graduated from Roman Catholic High School. Growing up in the Kensington Fair Hill section of the city had its challenges. I did not grow up with the aspirations of being a lawyer, doctor, police officer, or fireman. Due to me being picked on in school, I gravitated to the guys in the neighborhood seeking peer acceptance. I started to go against the morals and values my parents instilled in me, and I adopted a street culture. This behavior, which consisted of drug dealing and other illegal activities, brought me numerous incarcerations for the next 30 years. It was during one of these incarcerations that I received the news that my father had passed away. I was not able to attend his funeral due to my high bail. My father's death brought feelings of resentment, guilt, anger, and depression. I truly believe that due to my lifestyle, I took my father to his grave. My spirit was broken, and the capacity to feel was lost. This led to an opiate addiction in prison. And in prison, I experienced periodic jolts of reality or self-awareness, with my using becoming uncontrollable and antisocial. I came out of prison with a fully active substance use disorder. One aspect of my substance use disorder was the inability to deal with life on life's terms. As I continued to go through a cycle of incarcerations, my world shrank and isolation became my life. I was seeing that substance use disorder was being treated as a crime or a moral deficiency. My spirit was broken, my life skills were reduced to a low level, and found myself sleeping at times on the Gurney Street tracks. The capacity to feel human was lost. This led to several suicide attempts by trying to overdose, but I was saved by this community with Narcan every time. My life-changing moment happened in a courtroom when the judge stated that if I committed another crime, I would spend the rest of my life in jail. It was during this incarceration through treatment that I identified the core of my substance use disorder, which was learning to properly grieve my father's death. Upon my discharge, I decided to go to a recovery house and continue my therapy and my co-occurring issues. I was committed to a new way of life by putting some structure and being open-minded, willing, but most of all, to be honest with myself and others. It was in a recovery house that I was offered employment and the opportunity to give back and find restoration in my life. Through this opportunity, I learned about the trainings and services at the Department of Behavioral Health and Intellectual Disabilities, who offered to people in recovery, and I applied for the Certified Peer Specialist training, which gives a person in recovery the opportunity to use their lived experience by supporting people to attain a better quality of life. In 2016, I graduated from this training with several job offers. I decided to work for the Community Behavioral Health. It was there that I was given the opportunity to build my life professionally, financially, and most of all, personally. After 10 months, I moved into a position to assistant to the special liaison to the Deputy Commissioner of DBH-IDS. In this position, I had the opportunity to share my story in different aspects to spread hope and healing while assisting many of the DBH-IDS initiatives. I had the privilege to share my lived experience on a subcommittee for the Mayor's Opiate Epidemic Task Force. I was recently transferred to work in the Planning Innovation Division as a Senior Peer Initiative Specialist. I'm the lead Narcan training facilitator as well as being one of the team leaders at the DBH-IDS Overdose Rapid Response Team during the surge, and have been recently invited to be on the Philadelphia Resilience Project Advisory Committee. After many years of substance use and mental health disorders and being part of the problem in the community, I have chosen to be part of bringing solutions to a community that is near and dear to my heart. I volunteer in the city's cleanups and initiatives to help strengthen our neighborhood. I have learned that to help strengthen a community, we need to not have a 9-to-5 mentality, but a 24/7 approach. Today, I am proud to say that I have 46 months in recovery and working on getting my degree. I'm not only a father to my children, a brother to my siblings, but most of all, a son to my mother. I can say that all my liabilities of my past have become assets. And I hope by sharing my story with you, I've been able to help you put a face to recovery and destigmatize substance use and mental health disorders. Thank you.
Thank you, Ramon. Real quickly, before we go to the last two, and I'm gonna have to keep you guys down to 3 minutes. I want to recognize our police department partners, Deputy Commissioner Sullivan and our Inspector Bachmeyer, who are here with us. As many of you heard, there's a lot of challenges around public safety, and we have asked our police department to go way beyond the scope of their duties and what they signed up for, and we appreciate their partnership and their work with us, so thank you very much. So, I have your Adrian, por favor, and Asteria, and I'm really gonna keep you guys to 3 minutes.
Sounds good.
We're a half hour behind, 45 minutes behind.
Thank you for this wonderful opportunity. My name is Adrian Rivera Reyes. I am a Philadelphia resident, a proud Philadelphian, Puerto Rican, Boricua.
And, you know, today we've talked about what City Council is doing, what they're doing with different community organizations, and how they're working to address this epidemic, this opioid epidemic, which to me is a personal issue, right? This is affecting our communities and our families and our neighborhoods. Ramon just gave that wonderful and beautiful testimony. And so, you know, to me, this is personal because in the early 2000s, it was my uncle who died of HIV contracted by unsafe usage of needles, right? It was my cousin earlier this year, in January of 2018, that passed away, that overdosed with her husband, leaving 2 children behind, right? This is real, and this has to be addressed now. And we need bold, progressive motions and legislation to actually get this solved, right? This is not gonna come, this is not easy, and we all have to work together. And so I ask City Council, as a constituent, as a resident, that we need to do more. We need to do more, and we must do more. Again, this is personal. So I stand here today in front of you, and I appreciate all the work that you're doing, but it has to be more. It has to be, because we are dying. Our community is dying, our people are dying. There's people in the streets, right? This is about compassion, it's about humanity, right? So we need to address that. So I stand here today as a healthcare professional in front of all of you and in front of this beautiful, beautiful community, knowing that all of these things and these personal experiences and these issues, right, have affected my life directly, and I know are affecting our community and our people and our lives directly. And so with that, I want to say, you know, all of these things have led me to one very simple conclusion, but very big conclusion. And so I am a prospective candidate for City Council at large next year, because I want to take part of this issue and I want to help solve this issue. And I look forward to working with all of you in the near future. Thank you.
Welcome to the chaos.
First of all, you look gringo to me.
Call them out. Don't write that.
Asteria
You're
Vives.
the last one, Asteria. No pressure, but pressure. Avanza.
I'm sorry.
Asteria Vives with Home Quarters and Friends, community activist. In working in the streets for many years, I focused on the under the bridge before the cleanup with a lot of the homeless, especially that had the addiction of drugs and alcohol. Now there's a big difference, but it's not because it's also because, let me put it this way, a lot of people came from Northeast, from New Jersey, from Chester. So the question is, what are we doing about it? Okay, because you can tell if you work in the streets, you know who's new, you know who's been there. And those that live in Philadelphia, when they would come in and they're new, I would send them back home. I would personally take them to the train station to go back home, and I would give them tokens. Couches and chairs that are placed there, they want to give you the impression that it's to help them. No, it's so they can stay there and they don't go back to their neighborhood, which is in Northeast, in Chester, New Jersey. Families have given up. Not all, families have given up, and that is also part of the problem. Videotaping them, exposing them, and then having the audacity to say that they have no shame. You should be ashamed of yourself videotaping them and placing them on social media. Because when they've given me permission, in working under the bridge, giving me permission to videotape and photograph, you have never seen me expose that information. One of the things that I want to say that's really important is, in the shelters there was a program. It was called Fees and Savings, which Lisa Hirsch is well aware of that. When families or people that have an addiction go into these shelters, their fundings, if none of you are aware, 60% of that will go into a net, into a savings which will help them save for a home or for a room. 15% will go into fees in the shelter. Then 25% will go to them for allowance. Let it be cigarettes, candy, hoagies.
After the end of the fiscal year of 2016, as Lisa Hirsch is well aware because she was a main supporter of stopping this, they stopped this program. And I kid you not, by December of 2016, we spoke, me and my partner, Charito Morales, spoke to the Inquirer about the drastic change and the need in this change. Such a coincidence, when they stopped this fees and savings program, we started getting a more abundance of people out in the street. Why? Because when you stop a fees and savings program, what you're doing is you're not giving them hope anymore. You're slapping all the funds that they're receiving from the government on their hands, and now they're going out in the street and spending it all on drugs because they no longer have this program and saving 60% in savings to be able to save for a home or for a room to give them hope. So you're talking about beds and saving beds. Why don't you talk about why you stopped the program? Because you're so busy comparing with what other states do, and you can't do that. You can't do that. Because over in Front Street and Lehigh Avenue, all of that area, if you know the records, that was the worst area in the United States. Now you stop the fees and savings program and you don't speak about that. And a lot of people out here and our advocates are unaware of that, but I'm making it known. So I want to know, when is that coming back? Why you stopped it? Because people are addicts that people save because they're actually people, okay? Just like dogs are children. When you send them out in the street, what do? Instead of giving them activities, instead of giving them basic life skills, you send them out in the street to what? Then they come back at night to go to sleep, you send them back out in the street to what? Does that make any sense when you're not giving them any activities or even basic life skills, especially when many of them are young people that have the addiction of drugs and alcohol? So this is what I want to say. And then one of the things I've noticed is that a lot of the people in housing that speak about, oh, I don't have enough beds, I can't give you a determination or a deadline. You came here, in your mind, you're set, I'm not giving a date. I'm not giving a date, and that's what you did. You came with that attitude, which is pretty disgusting. Now, what I want to know is, you're not, first of all, in my opinion, you're not compassion. I don't see you out in the street cleaning. I don't see you out in the street, community services. You're 9 to 5. And if you are out there in a community event, you're paid for 4 hours, you're done, you're packing up in 3 hours. So you're not really for the community. So if it means that we need to replace people that are not there for the community, then that's what we need to start doing. But what I want to know is, when is that fees and savings coming back?
So you have to direct it at me because this is a hearing. And we will get.
You know, I didn't look at you because I don't want you to think I was directing it at you, like I'm blaming you.
That's okay, and I appreciate that. So here's what I would say, because I know there's some confusion with cash assistance and other stuff. We will get you some response around state cash assistance and some of that money and have it respond back to you. So
just to share with you, I've had short contracts with shelters, so I do know the program.
Okay.
Thank you so much for your time.
We're happy to get you an official response to those questions. I want to end and I want to thank Councilman Swilla, who's kind of been my partner in crime in all of this, Councilwoman Gim, and the rest of the council who came here. And while we will officially recess, because as I said, this is not the first conversation, this is actually the third on this hearing. We are going to recess today. I will add that we are hearing folks from the community. Excuse me, give me a little bit of time. We are hearing the folks in the community. We are trying to go from, as you heard from some of our providers and some of the government, be a little bit more nimble about trying to meet people where they are. This additional funding that we have to add beds is so that we can remove the encampment that we have. We are committed. I will say this, I want to be real clear. We're not going to give 700 beds to clean up Kensington, and Kensington residents cannot wait for us to have 700 beds to clean up Kensington. And so part of our challenge continues to be how do we get to a place where we stabilize and stop the normalization, normalizing some of this behavior out there. I will tell you that through Project Resilience and some of the work that we're doing, we remain cautiously optimistic. And we know that the mayor has come down here personally himself and made some commitments. This is all hands on deck. Dennis, we do not have time and you did not register. Mr. Havoc.
Just 1 minute.
No, I'm not gonna give it to you.
Just for the record, that's all. Thank you.
Mr. Havoc. You can give it to us in writing and we'll put it for the record.
Oh, you know I'm gonna be in writing all over, you do that.
Yep, of course. In case you don't know, Dennis Payne is an active member of Kensington and the leader of Havoc, who causes havoc on social media and keeps us
And
attacked.
for the record straight, we, the residents, the property owner, would like to know what this letter is about to the property owners. It wasn't discussed tonight, and I waited all night to hear it.
Okay, I will briefly, just for your purposes, there was a letter that was sent out with no stationery and signature notifying people who had lots or vacant properties that they have to maintain the property maintenance code, which is get a vacant license or have your property clean and sealed to avoid smaller encampments from forming. There was some confusion. There was a new letter that was sent out, the copy that is in your packet for purposes, because there was confusion around this information about the property maintenance code so that people who have vacant lots are responsible for them. So that is the notification that if you're a property owner, whether your property is vacant or not, you have to have a license and you have to have it up to code. So that is the letter there. Thank you, Mr. Dennis. Thank you. And with that, we conclude this hearing to the call of the chair. Thank you.